Hello dear students, we'll discuss the topic, see what exactly it is. So what this condition is, see that scrotum, there is a tortuous bag of worm feeling here. You can see here, bag of worm appearance, tortuous areas, venous tortuous areas above the testicular level. Typical, very typical bag of worm feeling. If you feel, you can feel it. You can feel impulse on cuffing also when you palpate. Short, very soft feeling, commonly on the left side, sometimes on the right side. It's a very typical of varicocele left side scrotum, common short note asked, MCQ they will ask, Viva they will ask. It is left side scrotum common, bag of worm filling, should be examined standing, it's very, very important. And later lying down position. Check the reducibility. Usually idiopathic one is reducibility, but if the left side renal cell carcinoma, when there is a proliferative thrombus occurs in the left renal vein, and it blocks completely, and varicocele won't get reduced. Irreducible left side varicocele is seen in dragging pain, cuff impulse will be present, often infertility due to temperature changes presentation may be there. So infertility is quite common, semen count will come down due to temperature changes. That is the important thing. Semen analysis has to be done in the patient. Examination standing is important. Impulse on cuffing should be checked. So ultrasound Doppler scan with the Doppler with the abdomen imaging is needed. Semen analysis should be done. Treatment is ligation of varicocele through various approaches: inguinal, suprainguinal, Palomos operation, and extrainguinal and scrotal approach. All these approaches are important. Laparoscopic approach also can be done in these patients. So this is important. It's very commonly seen patient. You should examine standing and lying down. Reducibility should check for, and bag of worm feeling. That's important. Left side, it enters the renal vein directly. Right side, right testicular vein drains into the IVC obliquely. So left side is common. It's very common in the left side. Right side also can occur. That is the important. It occurs in young age group. So semen analysis is important. All these approaches are important. Palomos, inguinal, extrainguinal, suprainguinal approach, scrotal approach in large. There are grading of the varicocele, grade 1, 2, 3, 4. So this is a common short note task for students. You can always go through my book where it given in detail about different approaches, grading, principles, and clinical examination. So answer the MCQ. After varicocele surgery, venous drainage occurs through penile veins, hypogastric veins, cremasteric veins, iliac veins. Find out the right answer. Students, I'll get back to you. Reason for varicocele being common in the left side is left testicular vein drains into the left IVC, left testicular vein drains into the left renal vein, left testis is lower than right, rectum compresses the left testicular vein. Find out the right answer. I'll put the right answer later. Students, I hope you understood varicocele, which is very commonly asked a short note in the exam. It's a differential diagnosis for expansile impulse on cuffing, and bag of worm feeling is important. Students, so please go through my SRB's clinical methods in surgery, current edition. It gives a video like the examination of the different clinical situations. It gives a detailed examination method, including history taking of swelling, ulcer, hernia, inguinal swelling, mass abdomen, breast lump, thyroid, neck swelling, salivary glands, all topics, including briefly trauma, how to approach orthopedic briefly. Then it also includes the instruments, specimens, images, briefly operative surgery, entire thing, clinical method with a lot of photos, illustrations. Each condition's photos are there. It's very clear. And analysis, history taking, detail, examination, general examination, history taking, history of present illness, and past history, current history, treatment history, drug history, local examination, inspection, palpation, percussion, auscultation, clinical diagnosis, differential diagnosis, and briefly in a table form, all differential diagnosis. But it doesn't contain treatment aspect, because clinical surgery book only for clinical surgery, analysis, and differential diagnosis. So treatment should be checked in detail. Principle of treatment should be checked in the manual, my SRB manual of surgery. So this is basically clinical book with the videos of each examination, with all illustrations, principles, different methods, different techniques, science. My SRB manual of surgery current edition gives a CBM syllabus, entirely covers all topics: general surgery, endocrine, surgery, thyroid, breast, GI surgery, urology, cardiothoracic, neurosurgery, then other topics, arteries, disease, veins, its principles, methods, clinical methods, treatment, complications, approaches, with the quotations in the each page. It covers entire thing, including treatment principles, brief operative procedure also, not in detail. And it also covers briefly instruments, images, anesthesia, briefly oncological aspect, and daycare surgery, audit, surgical audit, metabolic response to surgery, pain management, everything covers as far as required for the CBM syllabus for UGs, PGs and consultant, coming consultant also, with illustrations, photos, a few video lectures and a lot of MCQs online for each chapter with the QR code. Lot of MCQs for each topic, so each chapter it is there, covers everything for UGs, PGs, CBM, MCQs, NEET exam, whatever required thing. Please go through it. Very, very useful book. My operative surgery, extensive voluminous book, 2-volume book, mainly for postgraduates and learning surgeons. All procedures, including major surgery, GI surgery, general surgery, thyroid, breast, and other things. Include briefly gynecology surgeries. With step-by-step illustrations photos, more than 10,000 photos and illustrations are, and which covers everything for to learner. You can, before surgery, they can go through my book and have a step-by-step for the all surgeries, whatever common surgeries, major surgeries, it is there. You can always go through that. In detail, explanations are there. My small atlas of tissue approximation with the videos shows clearly, means with the principles, how to suture tissues. Dissection and tissue approximation, there are two parts in surgery. Dissection is a principle, essential. After dissection surgery, you have to approximate tissues, deeper layer, skin, softer tissues, everything, bowel, GI, everything. So this principle of tissue approximation clearly given in this book with the videos of it, including laparoscopic tissue approximation. So you can always purchase that and go through that. Very, very useful thing for to develop the skin, which is essential for all surgeons. Students, I also request all of you subscribe my website, both in YouTube, Instagram and so on. My DigiNow lectures to the JP publisher covers around 220 lectures in detail as far as CBME syllabus, general surgery to specialty, urology, clinical examination, cardiothoracic, neurosurgery, all topic, GI, rectum, anal canal, colon, esophagus, liver, pancreas, breast, thyroid, neck, salivary gland, general surgery, artery, vein, everything in detail, all topics, theoretical aspect, surgical principle, operative surgeries, the examination, clinical examination videos also. It covers 220 lectures, covers everything. 1 year purchase you can do. It gives detailed thing about explanations with wherever MCQs are required. You can make use of it and you can learn surgery properly as far as CBM syllabus and academic wise also. It gives lot of information towards the surgical field as such. So students, I hope you have understood this lecture very well, and also you can go through my books, all these books, with including DigiNow and lectures. Thank you very much.